Okay, just before break, we were speaking with Federal Health Minister Patty Hajdu. Had a bit of technical issues, but we are rejoined by phone. Good morning to you, Minister.
Thanks for calling back. That was a little disconcerting, yes.
You know what, technology these days and things that we need to deal with. Live TV, but I digress. Let's get back to the business. So I know you do have an announcement planned with Mayor John Tory and Dr. Eileen de Villa with Toronto Public Health. Can you elaborate a little bit about what is going to be happening here? We understand it does have to do with federal funding.
It does, yeah. We know that as we work through COVID-19, there's so many ways that we need to support provinces and territories and local governments in the incredibly hard work they're doing to contain spread of COVID-19. So I'll be with Mayor Tory and Dr. de Villa later to speak about additional measures that will go directly to the City of Toronto to ensure people have safe places if they've come into contact with COVID-19 or have been close contacts. And I'm really looking forward to this announcement. It's something we've been working on for a long time. Part of the challenge in Toronto is very crowded housing, and so getting people space to isolate properly is a big deal. And so that's part of the nature of the announcement.
Indeed, it has been an ongoing issue. Thank you for that, Minister. I also want to clear up some confusion. We heard from Premier Doug Ford talking about the Quarantine Act, and there were over 600 people in the province in the last few weeks that, were breaking those quarantine rules, meaning they should have been isolating for 14 days. They weren't after traveling from outside of Canada, and that we don't have the power or the jurisdiction to lay those charges. Is that true?
Well, in fact, that's true. And in fact, what we do with the provinces and with local enforcement is that we work really closely with all of regional enforcement to ensure that travelers are complying when they come into Canada with the mandatory isolation order. In fact, at the first line of defense it's at the federal government. We make sure we call people, we get in touch with people and ensure that they understand fully what their obligations are as they enter Canada. This is anyone who's entering, whether they're Canadian or not. And then if we find that there is a suspicion people are not complying with the mandatory isolation order, we refer them to local law enforcement. And so, again, as I said yesterday, the province has the full authority to enforce the act and to lay penalties and fines according to what they determine, the degree that the Quarantine Act has been violated.
Okay, so indeed the OPP can lay those charges. So thank you for clearing up that confusion here. I want to talk about the second wave, which we know is coming. To what degree, we don't know. Here in the City of Toronto, at least, we've reactivated that emergency centre and looking toward that wave. Do you believe we as a country are ready?
I believe we've learned a lot since the first outbreak, absolutely. And we know that in the fall, what we're really all working towards is not having the same level of surge that we saw in February and March. But having said that, I believe we have to be prepared for anything. And so that's the work that we've been doing with provinces and territories, making sure people have, for example, billions of dollars across the country for testing capacity and contact tracing and the data to manage all that information, things like the COVID Alert app that I really encourage everyone to download now, which can help you get notified if you've come into close contact with someone who's received a diagnosis of COVID-19. All of these tools are new, and they are going to enhance our ability to respond together to whatever COVID-19 throws at us this fall.
Minister, I'm glad you brought up that app. Is there a further update as to people who are actually downloading it? There have been a number of kinks here with people saying, if I have a lower version phone, I can't do it. Had some technical problems with it. Are there changes that are continuously happening, an encouragement for people to download so that it can be as active of a tool as it can be?
We're certainly promoting people to download it. We know that it doesn't work on some older phones, and I know that the technologists are looking at how to address those kinds of concerns. But what I'll say is those that can download it, please, because it is a really important app. It's constantly being updated and refined. What it does is, first of all, completely protects your privacy, but it sends a signal to cell phones that are close to you, that you've had close contact with for longer than 15 minutes. And then if one of those phones, one of those people is diagnosed with COVID-19, they receive yet again another code to put into their phone, and then it just lets you know. It'll ping you and say, you've had close contact with someone who's been diagnosed. Go get a test today. It gives you that peace of mind that if you do come close to someone who's had COVID-19, that you're going to be able to know that really quickly and get treatment really quickly. And conversely, it lets other people around you, if you become co-diagnosed, anonymously understand that they've come into close contact. You know, this is really important, this anonymous piece, because people feel, and they shouldn't, but they feel, you know, afraid or ashamed to tell their friends that they've been diagnosed with COVID-19, and this takes all that fear and shame out of it, and it allows for an anonymous notification of cell phones of people that have been close by you.
But indeed, it does take people to download it to make this as effective as we can. I want to ask you one last question here. As everyone's been talking about vaccines, I know the Government of Canada has set up through procurement some deals. Where do things stand with those, but also at-home possibilities? We know there are a number of candidates that are working on possible vaccines here at home.
Absolutely. So we have 4 companies that we've invested in to procure early doses when doses become available. And we've also supported a number of Canadian companies, too, that are developing a vaccine here domestically, which is really exciting as well. I'll just say this on vaccines. The reason why we've made so many diverse investments is because really the world doesn't know which vaccine is going to work. So it's really important that we have a diverse sort of, I guess, investment, if you will. It's almost like investing money. You want a diverse portfolio of vaccines so that in the case that some aren't successful, you have options for others. And we're using something called a vaccine task force, a group of experts, researchers, experts in pharmaceutical care and development and vaccine development to help guide us because, of course, these are very technical decisions and the stakes are really high.
Absolutely. Minister Hajdu, appreciate you taking the time to chat with us this morning. Thank you.
Well, thanks for the second attempt. I really appreciate it.
Yeah, you got it. And we will be streaming that as well on citynews.ca. That announcement with Minister Hajdu and Mayor Tory, that's happening at 9:30 this morning.